Can you all hear me and see my slides?
Yep.
Great.
Yes.
So I really want, this is going to be quite a brief talk, and I do want it to be interactive, so feel free to speak. You can easily unmute yourself by pressing the space bar on your computer, or type into the chat. And because really, you know, I'm not an expert on living with congenital heart disease. You all here are, and you all bring really wonderful and unique expertise. So I just bring a bit of expertise in psychology and mental well-being, and hopefully today is about kind of everyone sharing that expertise and taking one helpful thing away. So my talk is going to be, I really want to touch on the differences in how we approach physical health versus mental health, some common mental health challenges that we might encounter, particularly whilst living with a congenital heart condition, and ways that we can look after our psychological and our mental well-being. So, first of all, I'd like to ask people, what do you do, or what would you do if you had a really bad headache?
Take a Panadol.
Take a brief in.
Yeah, take some medication. What else?
Take a lie down.
Have a lie down. Yeah, take a break from what you're doing. Have a lie down.
Drink water. Turn the lights off.
Turn the lights off. Yeah, reduce stimulation. What about if you were cooking a delicious meal and then you burnt yourself, and you burnt yourself quite bad and had some blisters? What would you do?
Run it under cold water. First aid.
Yeah. Get first aid. Get some band-aids or clean. Put some ointment on. And what about if you broke a bone?
Go to the hospital.
See a doctor.
Yeah. If you, some reason ended up with, you know, you could see the bone and there's actually kind of blood everywhere, you might need to kind of get someone to take you to the hospital or ring an ambulance and get checked out, maybe get an x-ray, you know, then maybe go on a cast and have some physio for a while. So the things that these things all have in common, and similar to if you had symptoms with your heart, what happens when we have physical health problems? One, we tend to notice them. We don't tend to kind of ignore them. We're like, oh, I have a headache, or ouch, I've burnt myself, or oh, there's some pain, there's something wrong. And then you respond to it. You try to relieve the suffering that comes from it, and you get help when you need to. And you might, this might not be super conscious or automatic, but you know that headaches are common. You know that people burn themselves. You know that you're not the only one who breaks a bone, and you know that you can get help for it. But what would you do if what you were struggling with was not pain or a burn or a broken bone, but it was your thoughts or your feelings or your emotions? What do we do? And, you know, traditionally we kind of, or in the past, we know a lot about our physical health. There's structures in place where we can go and look for help, but mental health has kind of been pushed aside, and sometimes we tend to ignore things. So if we feel hurt, if we feel lonely, if we feel broken in terms of our thoughts or emotions, we tend to ignore them, just, you know, push on, keep doing what you're doing. And sometimes rather than responding with kindness and trying to reduce the suffering, we might add some suffering to it. So we might say, oh, why did you do that? You're so stupid. Of course, no one's going to like you now. What did you do that for? Why are you feeling like this? You shouldn't feel like this. You know, you're an idiot. We might say some really kind of harsh things to ourselves, or what's the point of doing anything? And we might kind of withdraw. And so we might unwillingly actually be adding to that suffering. And the third thing is we actually can often tend to feel alone in our emotional suffering. We feel like we're the only ones, or we feel like nobody else understands. And keep a lot of that suffering to ourselves. So it's quite a contrast, and hopefully this is actually changing, but it's quite a contrast in terms of how we automatically respond to our physical health versus how we respond to our mental well-being. And there can be embarrassment or shame or stigma attached that hopefully we are breaking down. So one thing that I hope society is learning is that actually our mental health is just as important as our physical health, and our mental health deserves the attention that we give to our physical health. And when we're actually physically unwell, that affects how we feel, how we think. And when we are struggling emotionally or with our thoughts, that often also affects our physical symptoms. If we're anxious, we'll get heart palpitations. If you're depressed, you get low or heightened appetite, you'll sleep more or less. So, they're actually connected and they're not separate. And what are some common mental health challenges? What are some things like headaches, diabetes, broken bones, what's the version in terms of mental health? What are some things that people in general might experience?
Anxiety. Depression.
Anxiety, depression.
Stress.
Stress.
Sleeplessness.
Yes. And
Low
what
appetite.
and what about any particular things or things that might be more common for people who experience who have a heart condition, or who live with others who have a heart condition, or who have family with heart conditions?
Health anxiety.
Health anxiety, absolutely. Particularly cardiac anxiety. A lot of worries about your heart and what symptoms might mean.
Denial.
Denial. A really strong protective mechanism that, if we deny it, it's not happening.
Uncertainty.
Guilt.
Absolutely. One of the topics that James wanted me to touch on is also survivor's guilt. So, living in a community like this, we might actually experience and come across the loss of people at a much younger age than what we'd like it to. So grief, loss, survivor's guilt. Sometimes our heart condition can get in the way of us doing things that we love, and that might lead to feelings of loneliness or isolation or social exclusion. ADHD, another kind of different ways that our brain can be wired, or trauma, which can come from experiencing multiple and repeated or just big medical procedures. So these are all really common things that the whole of the general population experiences, but they can also be more common.
No, still can't hear them.
Oh, who's that? We can hear you. Sorry that you can't hear us. So stress, anxiety, depression, grief and loss, loneliness, post-traumatic stress are some of the things that we might experience. And so, how many of you are familiar with this, with first aid kit? How many of you have a first aid kit at home?
Yep.
Yep. Yeah, I'd hope most people would have a first aid kit at home or see one. Maybe not as fancy as this one here, but you'll have some basics, like some Band-Aids, some aspirin, some Panadol. Masks these days are becoming part of that kind of first aid response. And sometimes we'll experience physical health challenges that we need to get the first aid kit out for, to tend to ourselves or to tend to others. But sometimes we need more than just our first aid kit at home. And we might need to see our GP or your cardiologist, or get an ambulance and go to the hospital. But how many of us have a psychological first aid kit? How many of us use a psychological first aid kit? And how many of us know where to turn to if we needed additional help? I'm sure that, oh, I've got some comments. Let's see. Oh, it's about not hearing. Okay. What I am curious, you know, because some of us do develop coping strategies, or you know, over time, and you have used things that have helped you get to where you are now. So, what are some things that are in your psychological first aid kit? What are some things that help you?
Meditation.
Meditation, love it.
Music.
Music.
Yoga.
Yoga.
Long walk.
Long walks. Great.
Medication.
Medication, absolutely.
For me, it's watching sport.
Watching sport. Hobbies. Yeah, some of my favorite things to have in a psychological first aid kit are, oh, here we go, breathing. And breathing is actually such a helpful and important tool that you always have with you to just switch off that stress, fight or flight response that happens so automatically in your bodies. Some of you may have seen on the breakfast show, the psychologist
You've faded out. Sorry, Vanessa.
Ooh.
Oh, that's better.
Is that better?
Yeah, thank you.
When we feel threatened, this happens to our brain, and our logical thinking is completely offline. And our breath is
You faded out again.
oh, that's so weird.
I don't think you can do that lean, because it's when you do that lean, it's when you fade.
Oh, is it from the voice that's
Yeah.
fading? Okay, maybe it's this. Also, we're learning a lot more about the role of nutrition and mental well-being. So actually getting a lot of micronutrients, that's a lot of vitamins and minerals from all different types of food types, can really help your brain to metabolize all the chemicals and all the, you know, endorphins, and balance out the stress chemicals and make everything work really well. And some sunshine, some vitamin D. Some people talked about long walks. In New Zealand, you know, particularly in winter, we can get a bit of a lack of vitamin D. And when we work indoors in offices all day, it can be a challenge to get that vitamin D, but vitamin D plays a key role in our mental well-being and also in our sleep. I think Diane talked about sleep and sleeplessness, and vitamin D is one of those really key chemicals that helps to regulate your melatonin in your sleep. Unplugging from social media. Who feels wonderful after going on a bit of a spiral scroll on Facebook? Sometimes we tend to kind of feel worse rather than better, or we start comparing ourselves to things that are not super realistic. So unplugging from social media. Taking perspective and focusing on the things that we can do rather than the things that we can't. Our brain's really good at focusing on the problems and the things that aren't going right in our life, and we tend to dismiss or look over the things that actually are. And for example, you know, perspective with the whole coronavirus coming into our community again, naturally there's a lot of understandable and normal anxiety. I felt a lot of anxiety when we heard that we're going back into level 3, that uncertainty again, some anger as well about the ways that things are functioning to keep everyone safe. But then what really helped me was kind of taking a zoom and taking a perspective and realizing that actually there's people in other countries who haven't had, you know, the weeks that we've had to connect with our friends and our loved ones again and feel safe temporarily. Some countries have been in lockdown for a really, really long time and still are under really strong restrictions. So sometimes actually zooming out and taking perspective can be really helpful. The Mental Health Foundation talks about the 5 key things to wellbeing: connecting with other people, even if it's virtually like this, being active, doing what you can do, giving back, helping others, taking notice of what's around you, and keeping on learning, keeping the brain active. A couple of other things are about knowing when to say yes and pushing out of your comfort zone, and facing a bit of our fears and doing things to kind of challenge ourselves and learn and grow, but also just as important to learn how to say no, particularly when we're stressed and overwhelmed, giving yourself permission to actually say no and not overload yourself, and just be okay with doing what you can. And part of that gratitude is kind of that perspective and being able to balance, yes, there may be some really difficult things in your life, but also what are some good things? It can help get out of our tunnel vision perspective and keep things in balance. But if there's actually one tool that I'd really love you to take away from this talk, is this. And it's basically boils down to responding to your mental well-being just as you would to your physical health. So the same things that we do when we notice a physical health problem. One, we notice, we stop, we pause. Oh, I have a headache. Oh, I've burnt myself. Oh, I'm in pain, I've broken a bone. Okay, so it's actually noticing it and naming it. Oh, I feel lonely. Oh, I feel depressed. Or I'm grieving. I feel survivor's guilt. I'm anxious. So actually noticing and saying it. And then responding, tending to it with compassion, with care. What can I do to help relieve some of the suffering? What do I need right now? What's going to help me? And in the short term, it might be things that make us feel good temporarily, like what might make me feel good right now is eat more chocolate and drink more alcohol and go smoke a packet of cigarettes, or yell at my partner or yell at my kids, because that makes me feel good in the short term, but it can actually increase our suffering in the long term. So it's more of, what do I need to do now that might be uncomfortable, but it can help me heal and recover in the long term? Like when you have a wound and it's infected and you need to put some tea tree, it's going to burn and you're not going to like it, but it's going to help later on. So how do I reach out and talk to a friend? How do I reflect on my behavior and apologize? Or how do I make time to grieve for the person that I've lost and connect and feel that? And then lastly, it's remembering that common humanity. I'm not the only one who gets headaches. I'm not the only one who experiences anxiety. I'm not the only one who experiences health anxiety. I'm not the only one who experiences grief and loss and anger. So realizing that actually part of suffering and part of emotional suffering is part of being human, and just how our physical bodies aren't perfect and they're prone to infections and flus, diabetes and cancer and heart problems, so are our minds. They're not perfect, they're human, and we can experience challenges as well. It's not about avoiding them or meaning that we're weak. No, it's about kind of managing them and making the most of our lives. It can be really hard to apply this to our emotional well-being when sometimes, we've learned to not do that, or to do the opposite, or to kind of be tough and toughen up and get over it and get on with things and don't whinge, don't complain, don't cry. Those kinds of things can make us just want to kind of shove things under the carpet. But actually, we know that actually responding with compassion and responding how you would to a friend that was suffering is actually a really, really helpful way, and scientifically a much kind of healthier way linked to better well-being for us. So self-compassion is not self-pity, it's not self-indulgence, it's actually having the courage to be vulnerable and do what's important to improve things for yourself. Another key part of looking after our well-being is asking for help. And often there'll be a lot of people in our lives wanting to help, but they have no idea how. They haven't walked through your shoes. They haven't lived the things that you have lived. And sometimes them seeing you in distress makes them feel helpless, and they start throwing all these things at you that aren't actually helpful. Like family that tend to criticize us and point out all the things that we're doing wrong. They tend to do that because they want the best for us, but it can actually make us feel worse. And sometimes the only way of accurately getting the help that we need is being vulnerable and having those open conversations and saying, actually, what I need from you is to not talk and to listen. What I need from you is a hug. What I need from you is space. What I need for you is to trust me to look after myself. So being really clear about what it is that you actually need and find helpful from others so that they can start doing those things. And similar, when you're wanting to help others, actually asking, what's the best thing that I could do for you right now? Or sometimes we have symptoms and they're really weird and we don't understand them, like a stomach ache and something else. And so, red eye, and then a lot of us will go to Google and start Googling, what are these symptoms? What do they mean? And what can I do about them? In a similar way, that applies to our mental well-being as well. And it's okay to seek information. It's just being careful about Dr. Google and actually finding out the right resources for information. So you're all already linked to Heart Kids, which is an incredible organization where you can turn to for advice and guidance on information. There's the wonderful American Congenital Heart Association, and I've recently discovered they've got a host of webinars on a host of different topics on congenital heart conditions by experts in America that are really useful, and they have a lot of information as well on emotional well-being and coping. The Mental Health Foundation or health.govt.nz, they have like an A to Z on mental health conditions and treatments. So if you're wondering, rather than kind of diagnosing yourself, seeking some information. The wonderful depression.org.nz website by John Kerwin, and the app that he has made and made available for free called Mentemia. I have yet to try it, but if anyone has tried it and has some feedback, I would love to hear it. The app My Life, which is used to call Stop Brain Think, is one of my favorite apps, and I still use it at night time for some kind of guided meditation and some wind down after the day. The Mental Health Foundation also has some really great information, but one of my favorite websites of recent is justathought.co.nz, and they actually offer free online modules that you can do at the confidentiality of your own home on anxiety, depression, and coping with COVID, during COVID-19. So that's a wonderful resource, because we know that the rate at which we train doctors and the rate at which we spend money on hospitals and physical healthcare far outweighs our training for counsellors and psychologists and mental health treatments and mental health interventions. And it can actually be really hard to access. So this is a wonderful website that's free to everyone in New Zealand. There's also, and I know we have a few people from over the ditch and over in the UK, which is wonderful to be connected, from so far away. But some of these might not apply to you, but there'll be definitely local resources available there as well. Just how sometimes our first aid kit is not enough at home, and sometimes Googling symptoms and finding out some home remedies is also not enough. sometimes we need professional help. Sometimes we need to see our GP, sometimes we need to see our cardiologist, sometimes we need to go to the hospital. That's the same in the mental health. Sometimes we actually just need some professional help. I don't know how many of you have called the 0800 Healthline number. I certainly have called it a few times. What's the symptom? What does it mean? Do I have COVID? A mental health version of that is 1737, okay? And you can call them and talk about what you're experiencing, and they're 24/7 confidential help and support. Our GPs are also trained in some basic mental health, and some GPs are better than others, but finding a GP that you can trust and being able to talk to them about your mental well-being, that's actually part of your whole well-being as well as your physical well-being. Sometimes they can themselves help you, sometimes they can refer you to local support services. DHBs are another good resource for when you need extra support and some professional support. So asking your cardiologist for a referral to a social worker or to an occupational therapist or a physiotherapist. Physiotherapists can actually be really helpful when you're experiencing anxiety, because they can help you with some breathing exercises, and they can do a breathing assessment on you. And physios can also help people with depression get going. So just because there might not be a psychologist attached to your service, it doesn't mean that there's no help available. There are different professionals that can help. If you're attached to an educational institution, to a university or to a tech, they tend to have free counselling services for students. So inquiring with your university health services, they often fund a few sessions free with no questions. Or at work, a lot of employees are now getting on board the EAP program, particularly big employers, where they also offer 3 free sessions per year to employees, and you can do that confidentially as well, and you can request more, and they can fund up to 6 or so, depending on what EAP. And just briefly, there's also different types of mental health specialists. There's counsellors, psychologists, psychiatrists, that all have slightly different training and can help in different ways. And there's pharmacotherapy as well, which is, some people just need insulin to manage their diabetes. Some people need antidepressants and, other medication to help. And it's very individual, whether it's mild, whether you're struggling with mild symptoms or severe. A lot of the recent research shows that rather than medication helping only for severe symptoms, actually they can be really helpful for mild symptoms too, but it's very individual. Some people respond really well, some people don't. And there's a lot of also research from a psychologist down in Otago doing research on nutritional therapies for mental well-being. And there's she's particularly trialing multivitamins and the impact of that on mental well-being, and it can be quite a protective factor, because when we're stressed, we use a cascade of minerals, we deplete ourselves from magnesium and zinc and a bunch of other things. So it makes sense that actually feeding our brain, which deals with our thoughts and our emotions and processing things, is a key way to look after our mental well-being. And some of you a lot of people might think, well, what's the point? What's the point of talking to someone? What's the point of opening a can of worms? What's the point of talking about my emotions? And one way I like to think about it is like a linen cupboard. So we might experience difficult things in our lives, and because they feel difficult and we don't like them, we'll shove them away. You just chuck them inside the cupboard and shut the door and hope that, that's that and you'll be rid of it. But what happens is when the cupboard is messy and things are just shoved in, the door just flings open, and it can fling open and it can hit you in the face. You can fall over it, and it might come out as things like snapping at others for no reason. It might be like through flashbacks or through nightmares or through feelings or emotions that you're finding difficult and you don't understand where they're coming from. So therapy can actually involve kind of talking about and processing some of these things so that they're neatly stored in your brain, and now you have more control of the door, and it's less just flinging and reactive, and we're not getting rid of them, we're not deleting memories, but but you've processed them, you can understand them better, you can understand yourself better, and add some psychological tools to your toolkit, and have more control over that door. So my take home from this talk is that mental health matters. It really does, and it's just as important as our physical health. It's really important to build a psychological first aid kit that you have at home, you have accessible to you. Sometimes I like to actually do that with people, get them to kind of write down your go-to tools, because what's super helpful for Sophie might not be super helpful for Jordan. And so different things help different people. But when our brain is like this, it's hard to think, and we don't think about all the things in our toolkit. Whereas if we have a place to go, a notebook where we've got all the coping tools, then we can pick one out and try it. Sometimes having a box of things with visual or audio recordings, or things like this, sensory things, or nice smells, or things like that, like in an actual little toolbox, can help, or simply some notes on your phone. But then also sometimes we need a bit more than just some self-help, and we need to talk to a professional who can do an assessment and who can help us actually manage and work through some of those challenges.